Our surgeon told my family the operation was successful, then walked back into the waiting room saying I'd had a bad reaction to anesthesia, and they shouldn't believe what the nurses told them. I woke up in recovery hearing my mother scream. Not the controlled kind of upset that happens in hospitals, but raw animal terror that cut through the fog of anesthesia and made my heart monitor spike. A nurse was leaning over me, her face close to mine, whispering urgently, "Your surgeon made a mistake during the procedure? A serious one. He's about to lie to your family about it. I need you to stay quiet and let me document everything before he realizes you're awake." Her name tag said Angela Reeves, and her hands were shaking as she adjusted my IV. I tried to speak, but my throat was raw from the breathing tube. She pressed a finger to my lips. "Don't try to talk. Your vocal cords are damaged. That wasn't supposed to happen during gallbladder removal. Dr. Kovac cut something he shouldn't have. I watched it happen, and he told everyone in the OR to keep quiet. He's telling your family right now that everything went perfectly." My mother's crying got louder in the hallway outside recovery. I could hear my father's voice trying to calm her, then Dr. Kovac speaking in that smooth, reassuring tone surgeons perfect over years of practice. Angela pulled out her phone and took photos of my chart, of the monitors, of something on my neck I couldn't see but could feel throbbing with each heartbeat. "I'm risking my career doing this," she whispered. "But I've watched him cover up mistakes before. Last month, a patient died from complications he caused, and he blamed it on underlying conditions. He's protected by the hospital administration because he brings in millions in revenue. Nobody stops him." She tucked her phone away as footsteps approached. "I'm going to tell your mother what really happened. When I do, Dr. Kovac is going to come back in here and contradict everything I say. He'll claim I'm confused or lying or that you had a reaction to anesthesia that caused the damage. Don't believe him." The curtain swept open and my mother rushed in, her face blotchy and wet. My father was right behind her, looking gray and older than he had this morning when he'd kissed my forehead before they wheeled me into surgery. Dr. Kovac stood in the doorway, his surgical cap still on, his expression unreadable. "Mrs. Palmer, Mr. Palmer, your daughter is awake and stable," Dr. Kovac said, his voice warm and confident. "The procedure went exactly as planned. We removed the gallbladder laparoscopically with no complications. She'll be sore for a few days, but should make a full recovery." Angela stepped forward, positioning herself between Dr. Kovac and my parents. "That's not true. During the procedure, Dr. Kovac's scalpel slipped and he severed Rachel's recurrent laryngeal nerve. That's the nerve that controls the vocal cords. She may never speak normally again. He also nicked the carotid artery and had to call in Dr. Williams from vascular surgery to repair it. The operation took 4 hours instead of the scheduled 90 minutes. My mother's hand flew to her mouth. My father turned to Dr. Kovac with confusion hardening into anger. "Is that true?" Dr. Kovac's expression shifted from warm to coldly professional in an instant. "Nurse Reeves is mistaken. What she's describing didn't happen. Rachel had an adverse reaction to the anesthesia that caused some swelling around the throat area. It's temporary and will resolve on its own." Angela pulled out her phone. "I have photos of the operative notes before you altered them. I documented the complication in real time. I also have witness statements from 2 other nurses who were in the OR." Dr. Kovac's jaw tightened. "Those photos are a HIPAA violation. You're fired, effective immediately. Security will escort you out." He turned to my parents with practiced sympathy. "I apologize for this disruption. Nurse Reeves has been experiencing some personal difficulties that have affected her judgment. What happened to Rachel was an unfortunate but rare reaction to anesthesia. These things happen in surgery. The important thing is that she's stable now and will recover fully." My father stepped closer to Dr. Kovac. "My daughter can't speak. You're telling me that's from anesthesia?" Dr. Kovac nodded smoothly. "The intubation combined with her reaction caused temporary vocal cord paralysis. It should resolve within a few weeks. If it doesn't, we can explore other options. But I'm confident it will heal on its own." Angela was crying now, angry tears streaming down her face. "He's lying. I've been a surgical nurse for 12 years and I've never seen a reaction cause this kind of damage. He cut the nerve. I watched him do it. He panicked and called Dr. Williams to fix the arterial bleeding. Williams can confirm everything I'm saying." Dr. Kovac pressed a button on the wall and 2 security guards appeared within seconds. "Please escort Nurse Reeves out of the building. She's been terminated for gross misconduct and HIPAA violations." As the guards took Angela's arms, she looked at my mother desperately. "Check the surgical logs. The operation was supposed to be 90 minutes, but it took 4 hours. Ask why Dr. Williams from vascular surgery was called in for a routine gallbladder removal. Ask to see the original operative notes before they're altered. Please." They pulled her out of recovery, and her voice faded down the hallway. Dr. Kovac smoothed down his surgical scrubs and smiled at my parents. "I'm very sorry you had to witness that. Nurse Reeves will be reported to the state nursing board for her behavior today. Now, let me examine Rachel, and we'll discuss her discharge plan." He approached my bed and I tried to speak, to tell my parents that Angela was right, but nothing came out except a harsh whisper that hurt so badly I stopped trying. Dr. Kovac examined my throat with practiced efficiency, his fingers gentle and professional. "The swelling is already going down. I'm prescribing anti-inflammatories and pain medication. Rachel will need to rest her voice completely for at least a week. No talking, no whispering. Let the tissues heal naturally." My mother was watching him with uncertainty. But if it's just swelling from anesthesia, why would she need to rest her voice for a week? Dr. Kovac's smile never wavered. Because any use of the vocal cords right now could prolong the healing process. Think of it as a sprained ankle. You wouldn't walk on it immediately after the injury. Same principle here. My father pulled out his phone. I'm calling our family doctor. I want a second opinion. Dr. Kovac's expression cooled. That's certainly your right. Though I should mention that questioning my professional judgment could be seen as grounds for me to withdraw from Rachel's care. If you don't trust my expertise, perhaps you'd prefer to transfer her to another facility. The threat was subtle, but clear. My father hesitated, his finger hovering over the phone screen. My mother put her hand on his arm. Let's just wait and see how Rachel feels tomorrow. Dr. Kovac has been our surgeon for years. We trust him. That was true. Dr. Kovac had removed my father's appendix 3 years ago and had operated on my mother's sister for a hernia last year. He was respected, experienced, and our insurance covered him completely. Questioning him felt impossible when he stood there in his surgical scrubs radiating confidence and authority. But I'd heard Angela. I'd seen the fear in her eyes and the trembling in her hands as she took those photos. She'd risked everything to warn us, and now she was being escorted out by security while Dr. Kovac convinced my parents that I'd just had a bad reaction to anesthesia. I grabbed my father's hand and squeezed hard, trying to communicate something, anything. He squeezed back gently. It's okay, sweetheart. You're going to be fine. Dr. Kovac says this will heal on its own. I was discharged the next morning with prescriptions for pain medication and anti-inflammatories, and instructions to rest my voice for 2 weeks. Dr. Kovac visited before I left, accompanied by a different nurse who smiled pleasantly and avoided eye contact. Rachel, I want you to follow up with me in my office next week. If the swelling hasn't gone down by then, we'll consider some other interventions. But I'm optimistic you'll make a full recovery. He shook my father's hand and hugged my mother briefly. Call my office if you have any concerns. My staff will get you in immediately. After he left, my mother helped me dress while my father dealt with the discharge paperwork. That nurse yesterday was so unprofessional, my mother said quietly. I can't believe she accused Dr. Kovac of making a mistake. He's one of the best surgeons in the state. Your Aunt Diane said he has the lowest complication rate in the entire hospital. I tried to write on the notepad the nurses had given me, but my hands were still shaky from the anesthesia. My mother took the pen gently. Don't strain yourself, honey. Just rest. At home, I went straight to my laptop and searched for Angela Reeves. Her nursing license was active and unsuspended according to the state board website. I found her on social media and sent her a message. Dr. Kovac told my parents I had an anesthesia reaction. Can you send me the photos you took? She responded within an hour. I can't send you anything directly because of HIPAA and because I was fired, but I filed a report with the state medical board and with the hospital's patient safety committee. I also contacted a medical malpractice attorney named David Crane. His number is 5550147. He specializes in surgical negligence cases. I told him about what happened to you. He's expecting your call. I showed the message to my parents that evening. My father read it twice, his expression troubled. I don't know, Rachel. This feels like a disgruntled employee trying to cause problems. Dr. Kovac said she was having personal issues. I grabbed the notepad and wrote in large letters, check surgical logs. 4 hours, not 90 minutes. My mother looked at what I'd written and frowned. How do you know how long the surgery took? You were unconscious. I wrote, Angela told me before you came in. My father set down the message from Angela and rubbed his face. Okay, let's say, hypothetically, that the surgery did take longer than expected. That doesn't necessarily mean something went wrong. Complications happen. Maybe it was just more difficult than anticipated. I wrote, then why lie about it? That stopped both of them. My mother sat down slowly on the couch. He didn't exactly lie. He just said the procedure went as planned. I wrote, 4 hours is not as planned. My father picked up his phone and stared at it for a long moment. Then he dialed a number. I'd like to request a copy of my daughter Rachel Palmer's surgical records from yesterday. Yes, I'll hold. He waited, his jaw set in that stubborn way that meant he wasn't going to let this go. After 5 minutes, he hung up. They're mailing them to us. Should arrive in 7 to 10 business days. Those 10 days were the longest of my life. My voice didn't improve. If anything, it got worse. The harsh whisper I'd managed in the hospital faded to almost nothing. I could barely make sounds above a breath. Swallowing hurt. Breathing sometimes hurt. My mother took me to Dr. Kovac's office for the follow-up appointment, and he examined my throat with a scope, his expression unreadable. The swelling has gone down, but there's still some inflammation. Let's give it another 2 weeks. Keep resting your voice completely. My mother asked the question I'd written for her. Is it normal for an anesthesia reaction to last this long? Dr. Kovac smiled reassuringly. Every patient heals differently. Rachel's young and healthy. Her body will recover in its own time. I've seen cases where vocal issues from intubation took a month to fully resolve. This is well within normal parameters. But his eyes didn't match his smile. There was something calculating in them, something that made my skin crawl. The surgical records arrived on a Friday. My father opened the envelope at the kitchen table and spread out the pages. I sat next to him with my notepad ready. The operative report was 3 pages long. filled with medical terminology I didn't understand. But the timestamps were clear. Surgery start time, 9:15 a.m. Surgery end time, 1:47 p.m. 4 hours and 32 minutes. The procedure code listed was for a laparoscopic cholecystectomy, the standard gallbladder removal. Expected duration, 60 to 90 minutes. My father's finger traced down the page. It says here that Dr. Williams from vascular surgery was consulted intraoperatively for hemostasis. He looked at me. That means bleeding control. Why would a vascular surgeon need to be called in for a gallbladder removal? My mother was reading over his shoulder, her face pale. It also mentions injury to the recurrent laryngeal nerve with immediate repair attempted. That's exactly what the nurse said happened. The room was very quiet. My father kept reading, his expression getting darker with each line. He documented the injury, my father said slowly. Right here in the operative notes. He cut your vocal cord nerve and tried to repair it, but he told us it was an anesthesia reaction. My mother sat down heavily. Why would he lie if he documented it? I wrote on my notepad. Because documentation protects him legally. Lying stops us from suing. My father picked up his phone and called the number Angela had sent me. Is this David Crane? My name is Robert Palmer. My daughter had surgery 10 days ago, and I think her surgeon committed malpractice. Yes, I'll hold. He put the phone on speaker. A man's voice came through, professional and direct. Mr. Palmer, Angela Reeves contacted me about your daughter's case. I've reviewed the information she provided, and I believe you have grounds for a medical malpractice lawsuit. I'd like to meet with you and Rachel as soon as possible to discuss the details. Can you come to my office Monday morning? We met with David Crane in his downtown office, a sleek space with floor-to-ceiling windows overlooking the city. He was younger than I expected, maybe 40, with sharp eyes and a way of listening that made you feel heard. My parents and I sat across from his desk while he reviewed the surgical records we'd brought. This is textbook negligence, he said after 10 minutes of reading. Dr. Kovac injured a critical nerve during a routine procedure, called in another surgeon to fix the arterial bleeding, spent 4 hours repairing the damage he caused, and then lied to you about what happened. The operative notes clearly document the injury, which means he knew he'd made a mistake. But instead of being honest, he told you it was an anesthesia reaction. My father leaned forward. Can we prove he lied? He might argue he was just trying not to worry us. David shook his head. He documented a nerve injury but told you the voice damage was from anesthesia. Those are contradictory statements. And he fired the nurse who tried to tell you the truth. That's consciousness of guilt. A jury will see right through it. My mother asked quietly, what happens now? David pulled out a legal pad. First, Rachel needs to see an independent ENT specialist to assess the permanent damage to her vocal cords. Based on what you've described, the nerve injury is likely permanent. The recurrent laryngeal nerve rarely heals completely once severed. Rachel will probably need voice therapy and possibly surgery to improve her speech, but she'll never sound the same as she did before. The words hit me hard. Never sound the same. I'd been holding on to hope that this was temporary, that my voice would come back if I just waited long enough. But David was telling me that Dr. Kovac had permanently damaged something that couldn't be fixed. My mother started crying quietly, and my father put his arm around her. David continued gently. Second, I'll file a lawsuit against Dr. Kovac and the hospital for medical malpractice, fraud, and emotional distress. We'll also file complaints with the state medical board and request an investigation into whether Dr. Kovac has covered up other surgical mistakes. Angela mentioned another patient who died. We need to look into that. The independent ENT specialist confirmed what David had predicted. The recurrent laryngeal nerve on my left side was completely severed and had scarred over. My left vocal cord was paralyzed. I would never speak normally again. I could learn to compensate with voice therapy and possibly have surgery to reposition the paralyzed cord, but my voice would always be weak, breathy, and limited in range. The doctor was kind, but blunt. Whoever did this to you made a catastrophic error. The recurrent laryngeal nerve runs near the thyroid, but nowhere near the gallbladder. For a surgeon to cut it during a cholecystectomy means he was operating in completely the wrong area, or his hand slipped badly and he cut multiple structures. Either way, this is not a normal surgical complication. This is negligence. David filed the lawsuit 3 weeks after my surgery. The hospital's attorneys responded immediately with a motion to dismiss, arguing that surgical complications were inherent risks that patients accepted by signing consent forms. But David had the operative notes, the proof that Dr. Kovac had lied, and Angela's testimony about the cover-up. The case moved slowly through the legal system while my life changed in ways I hadn't anticipated. I couldn't go back to my job as a customer service representative because I couldn't speak clearly enough for customers to understand me. I couldn't sing anymore, which had been my favorite hobby since childhood. I couldn't yell if I was in danger. I couldn't laugh without it sounding like choking. Simple things like ordering food at a restaurant or answering the phone became humiliating struggles where people asked me to repeat myself multiple times or just gave up and walked away. My friends didn't know how to act around me. Some were overly sympathetic, treating me fragile. Others avoided me because my damaged voice made them uncomfortable. My boyfriend of 2 years broke up with me 3 months after the surgery, claiming the relationship had changed too much, and he needed to focus on his own life. I knew the real reason. He couldn't handle dating someone who sounded broken. Voice therapy helped marginally. I learned techniques to project what little sound I could make, to speak in shorter sentences so I wouldn't run out of breath, to accept that people would sometimes not understand me and I'd have to write things down. The therapist was encouraging, but realistic. You're doing great with what you have to work with, but the nerve damage limits how much improvement is possible. This is probably as good as it's going to get. Meanwhile, David was building the case. He deposed Dr. Kovac, who maintained under oath that he'd done nothing wrong, that the nerve injury was an unfortunate but unavoidable complication, and that he'd properly informed my parents about what happened. When David played the audio recording of my mother describing how Dr. Kovac had specifically said it was an anesthesia reaction, Dr. Kovac claimed he'd been misunderstood. I may have simplified the explanation for the family's benefit. Medical terminology can be confusing for laypeople. I assure you I never intentionally misled anyone. David deposed the other nurses who'd been in the operating room. 2 of them corroborated Angela's account, testifying that Dr. Kovac had cut the nerve, had panicked, and had explicitly told the surgical team not to mention the complication to the family. 1 nurse refused to testify, claiming she didn't remember the details clearly. David suspected she'd been pressured by the hospital administration. He deposed Dr. Williams, the vascular surgeon who'd been called in to repair the arterial bleeding. Williams was professional, but clearly uncomfortable. I was called to assist with hemostasis. When I arrived in the OR, Dr. Kovac had already injured the carotid artery and the recurrent laryngeal nerve. I repaired the artery. The nerve injury was beyond my scope. I documented everything in my consultation notes. David pressed him. Did Dr. Kovac discuss with you how the injuries occurred? Williams hesitated. He said his hand slipped. That testimony was damning. A hand slip during gallbladder surgery shouldn't reach the vocal cord nerve or the carotid artery. Those structures weren't even in the surgical field. The hospital's attorneys tried to settle out of court for $200,000. David advised us to reject it. Your damages are worth far more than that. Rachel has lost her career, her ability to communicate normally, and her quality of life. She's 26 years old. She'll live with this injury for another 50 or 60 years. The economic damages alone are over $1 million, not counting pain and suffering. We rejected the settlement and the case went to trial 14 months after my surgery. The courtroom was packed with spectators, many of them former patients of Dr. Kovac who'd heard about the case and wondered if they'd also been victims of his negligence. Dr. Kovac sat at the defense table in an expensive suit, looking confident and calm. His attorneys were from a prestigious firm that specialized in defending doctors. They argued that surgical complications were an inherent risk, that Dr. Kovac had acted within the standard of care, and that my injuries, while unfortunate, were not the result of negligence. David systematically destroyed their arguments. He brought in expert witnesses who testified that cutting the recurrent laryngeal nerve during gallbladder surgery was not a known complication. It was gross negligence. He played video depositions of the nurses who'd witnessed Dr. Kovac's panic and subsequent cover-up. He showed the jury the timeline, the 4-hour surgery for a 90-minute procedure, the emergency consultation with the vascular surgeon, the documented nerve injury that Dr. Kovac had lied about to my family. Most powerfully, he had me testify. I sat in the witness box and tried to speak, my voice a harsh, breathy whisper that the jury had to strain to hear. David asked me simple questions. Rachel, can you tell the jury your name? I tried. Rachel Palmer. It came out garbled and weak. Can you tell the jury what you used to do for a living? I whispered. Customer service representative. Several jury members were crying. Can you tell the jury what you can't do anymore because of your injury? I listed them in my broken voice. Can't work, can't sing, can't yell for help, can't order food easily, can't talk on the phone, can't laugh without pain. David let that sit for a moment. Rachel, do you remember what Dr. Kovac told your parents after your surgery? I nodded. He said I had a reaction to anesthesia, that it would heal on its own. He lied. The defense attorneys objected. Claiming I was speculating about Dr. Kovac's intentions, the judge overruled them. The witness can testify about what she was told and whether it matched the documented facts. When Dr. Kovac took the stand, David cross-examined him relentlessly. Dr. Kovac, you documented in the operative notes that you injured the recurrent laryngeal nerve, correct? Dr. Kovac nodded. Yes, but... David cut him off. Yes or no, did you document the nerve injury? Yes. And did you tell the Palmer family that Rachel's voice damage was from an anesthesia reaction? Dr. Kovac shifted in his seat. I may have simplified the explanation. Did you use the words anesthesia reaction when speaking to the family? I don't recall my exact words. David played the audio recording of my mother recounting the conversation. Dr. Kovac's voice came through clearly. Rachel had an adverse reaction to the anesthesia that caused some swelling around the throat area. It's temporary and will resolve on its own. The jury heard it. Dr. Kovac's face flushed. David continued. That statement was false, wasn't it? The voice damage wasn't from anesthesia. It was from the nerve you cut. The nerve injury and the anesthesia reaction could both have contributed. Dr. Kovac, yes or no, did you sever Rachel Palmer's recurrent laryngeal nerve during surgery? A long pause. Yes. And did you tell her family that her voice damage was from anesthesia? Another pause. I was trying to avoid causing them unnecessary distress. You were trying to avoid a malpractice lawsuit. The defense objected. The judge sustained it, but the damage was done. The jury had heard everything they needed to hear. Deliberations took 6 hours. When the jury came back, the 4 women read the verdict. We find in favor of the plaintiff, Rachel Palmer. We award economic damages in the amount of $1.2 million, pain and suffering damages in the amount of $2.5 million, and punitive damages in the amount of $5 million for fraud and intentional misconduct. My mother sobbed. My father squeezed my hand so hard it hurt. Dr. Kovach's face went gray. The punitive damages were the key. Those were awarded when a defendant's conduct was so egregious that the jury wanted to punish them beyond just compensating the victim. The jury had seen through Dr. Kovach's lies and wanted to send a message. David shook my hand afterward, his expression satisfied. The hospital will appeal, but we have a strong verdict. This will also trigger a state medical board investigation. Dr. Kovach's career is over. He was right. Within a week, the medical board suspended Dr. Kovach's license pending investigation into other potential cases of covered-up complications. Angela's report about the patient who died was reopened. 3 other former patients came forward with stories of unexplained complications that Dr. Kovach had dismissed as normal risks. The investigation revealed a pattern spanning 5 years. Dr. Kovach had made surgical errors in at least 8 documented cases, covering up each one with lies and manipulated records. The hospital administration had received complaints from nurses and junior doctors, but had ignored them because Dr. Kovach generated millions in revenue annually. One administrator admitted in a deposition that they'd been told about the problems, but decided not to act because they didn't want to lose a high-earning surgeon over unverified accusations. The hospital settled with me for an additional $3 million to avoid further litigation and public exposure. Dr. Kovach's medical license was permanently revoked. He was charged with fraud and practicing medicine with gross negligence. He eventually pleaded guilty to avoid prison time, receiving 5 years of probation and a lifetime ban from practicing medicine. Angela got her nursing license back and received a settlement from the hospital for wrongful termination. She testified at the medical board hearings and helped bring down the administrator who'd covered for Dr. Kovach. 2 years after my surgery, I started a foundation for surgical malpractice victims, using part of my settlement money to fund it. I hired Angela as the director. We provided resources for patients who suspected their doctors had made mistakes, connected them with attorneys, and advocated for stronger oversight of surgeons. My voice never improved beyond what voice therapy had achieved, but I learned to live with it. I got a job doing medical transcription from home, work I could do without speaking. I started dating again, eventually meeting someone who didn't care that I sounded different. I testified before the state legislature about the need for mandatory reporting of surgical complications and independent review boards. Some of my testimony was hard to understand because of my damaged voice, but that made it more powerful. Legislators could see and hear exactly what happened when doctors prioritized their careers over patient safety. 5 years after the surgery that destroyed my voice, I stood in a hospital conference room full of surgical residents and told my story. Dr. Kovach had taken something I could never get back, but I'd made sure he couldn't do it to anyone else. That was justice enough. Thanks for watching till the end. Make sure to subscribe and like to not miss the next story.